Have you been told that your bladder is weak, or atonic bladder, or flaccid bladder? Well, I'm going to explain to you what that means and how an enlarged prostate and not treating an enlarged prostate can lead to a weakened bladder. And this is important to understand. So us men, we take urination for granted. We unzip our pants and magic happens. But actually, a contraction is happening where a bladder muscle, a muscle like any other muscle, is pushing the urine outwards. And as the prostate enlarges, there's a restriction. So what happens is the bladder is working overtime. It's having to push harder and harder to urinate. And over time, the bladder muscle gets weakened and really doesn't function well in some cases. So even if someone comes and needs a procedure like a urolift or Rezum or a TURP or aquablation, and the bladder doesn't push anymore, these procedures actually won't help and someone can be left with a catheter. So I'm using a balloon as an example to explain what happens. So the bladder fills up and the bladder's a reservoir and it holds the urine. And when there's no restriction, the prostate is small, what happens is the bladder muscle will push the urine out and the stream will be good. And the muscle will push the urine outwards with a good stream. And one empties well. But what happens is, as the prostate enlarges, the stream gets restricted and the bladder has to work harder and harder. And over time, the bladder muscle gets fatigued, like a floppy bladder, as if a balloon that you've blown up. This balloon I blew up for several days, and even though this is untied, the balloon is floppy. And the same thing can happen with a bladder. If a prostate is restricting the outflow of the urine and someone doesn't attend to it or get some kind of relief, then the bladder muscle fatigues. We call it atonic or flaccid bladder. And even if the prostate is relieved, sometimes the bladder muscle doesn't work anymore and one can't urinate, and that is a problem. So I hope this explains why one should seek treatment and what happens if you're told that your bladder muscle is not working. And another reason why we intervene earlier these days is to save the bladder muscle, because while a cardiologist may have a pacemaker to pace or help a muscle of the heart that's not working, we really don't have a pacemaker for the bladder. So if you're having a restriction, get checked and perhaps consider having a treatment sooner than later so you don't end up with a non-functioning flaccid bladder and ultimately left with potentially a catheter. Thank you very much.